I know, you mad. You so mad. I don't know how we didn't hear that before. We are gonna pull a little mini horse named Coco in. Coco has a stable eye. It's not infected or cancerous, but she has microphthalmia and kind of a shrunken eye. So we're gonna do a lid margin resection and suture the eye closed so she doesn't have chronic dust and irritation affecting the area. It's a lot less invasive than a full enucleation is, but Coco also has some chronically elevated liver values, so we're gonna have to be really, really careful with our level of sedation, and hopefully our nerve blocks will work, so we're gonna try to do everything standing and as quickly as possible. Feel the little tiny divot right there? Right there? I know, you mad. You so mad.
She is doing auriculopalpebral and supraorbital nerve blocks.
We used 2 different numbing agents to, well, first we clipped and prepped, and then we numbed sensory and motor function around the whole eye. So we're not working with the eyeball itself, we're just working with the lid, but we want the lid to not be able to move and also make sure Coco can't feel what we're doing. So that is finished. We're gonna flush the eye socket out really well, and then we're gonna put some bupivacaine in the eye itself to kind of numb that, and then we'll be ready to go with our surgery. So obviously this patient is still really awake, and we will see very quickly whether or not we have full numbing of the eye. Great, so our nerve block worked on this side. Not having a response. Right, so that's it. That's the full lid resection. Gotta make sure you're getting all the way up here at the lateral canthus. And really, we just need subcute tissue so we have something nice to suture to. So I'm making sure I'm only gonna grab what I'm gonna cut off. There we go. Okay. So I'm pretty careful with this medial canthus. I want lacrimal gland to be able to drain. Okay, so resection is complete at this point. We should have good margins on both sides. So this is Coco. Our nerve blocks are working. We have successfully resected upper and lower lid margins. And now we are just gonna suture the lids closed and we will be finished. Almost done, friend. Doing great. Easy. So it's important to talk about the fact that this is very different from an enucleation in that when we do an enucleation, we're removing the eye and all of the surrounding lacrimal structures. And in this case, I'm leaving the tear duct and the lacrimal gland and everything. So this eye is still going to be able to produce tears that are still going to be able to travel down the lacrimal duct and drain out the nose or drain out the medial canthus of this eye. So we wouldn't want to close it up completely because then we could end up with kind of chronic tear buildup inside the eye, but because we're leaving all of those natural structures, we don't have to worry about that. So I'm going to do a horizontal mattress. It is a tension relieving suture pattern in the skin right here.
So Coco's eye surgery is done and we checked his teeth and he has a few things that need to be taken off. But other than that, he's doing really good.
Not bad, but you do need a little bit done. It's a very uneven mouth. He just has little points mostly on premolars, upper and lower. Not a lot, just a little bit. Also, he's mad about it, can you tell? You're doing great, Coco. This is his adult tooth, came in at a weird angle. Yeah, so he didn't ever shed his baby tooth. He's got Galvani's groom coming in up here. Yeah, so I would have put him at like 11, 10 or 11. We just finished Coco's eye surgery. He did great. He handled his sedation really well. His eye looks puffy because the stuff we used to block his eye made it look puffy, but he hardly lost any blood. He had some sharp points on his teeth that Dr. Gina fixed, and he is waking up. So really happy with how that went, and hopefully he can go up for adoption very soon. This is Saoirse. She came in through our buyout program last month, and she has a stable microphthalmic eye. So at some point, this cornea ruptured, probably from a really severe untreated corneal ulcer. And if we had seen it then, we definitely would have enucleated the whole eye because it's very painful. But at this point, her eye ruptured and then healed. When we do a full enucleation, we do it because the eye is inflamed or painful, infected, or that there's evidence of cancer. So Saoirse doesn't have any of those things present today, and she doesn't currently have any issues with her eyelashes rubbing. You're gonna lick my leg. With her eyelashes rubbing on the eye, but sometimes over time, as these eyes continue to shrink, the lids can roll in and cause irritation on that eye. So I like to do a lid margin resection, and Dr. Gina is gonna do her surgery today, where we basically just numb all the way around the eye, and then we remove a little bit of lid, and then we suture it closed. We're gonna leave all of her tear ducts and things in her eye, so the eye will still be able to tear, create tears normally and drain normally, but she'll be a lot easier to maintain, and that eye will be more comfortable for her over time. And then we're also gonna check her teeth, and if she's got any dental pathology, we'll be fixing that today too.
All right, so we're here with Saoirse, and once we had sedated her, we just listened to her. We try to do physical exams every time we have a chance. And so Dr. Lydia first heard a murmur, and she wanted us all to listen to it. And so she also has an arrhythmia, so you'll hear the murmur, and then a beat will drop, and then she'll pick it back up. So her heart has an irregular beat, and it also has a murmur. So that means her risks of having cardiac events have greatly increased. But we didn't hear it on intake, so I don't know if it's just more pronounced with sedation, but it's something that we have to consider about her long-term welfare.
Okay, go ahead.
All right.
Sweet. Go team.
We're almost there. Just need to get that little bit.
Kimberly, we are gonna need some sterile fluids to flush with. Sure. Looks like we have false blue eyelashes. some sharp points, but nothing terrible. I definitely would not say that her dental was bad enough to explain her poor body condition score. One thing that sometimes happens is that we have animals that don't have audible cardiac anomalies when they're not sedated, and then we can hear different things when they're sedated. So today, before we sedated her, Saoirse's heart sounded normal, but during her sedation, we were able to hear a murmur and an arrhythmia. So that's not an insignificant finding, but it's not significant enough that we want to make any kind of quality of life decision on her at this point, especially because as she's waking up from sedation, what we're hearing is fainter and fainter. So if we only have abnormalities that are present under sedation, sometimes that can be the effect of those drugs. So we're going to keep a close eye on her, but overall, I'm really, really happy with how she did today. Dr. Gina did an awesome job with Saoirse's eye surgery. Everything went very, very well. We did her dental too. She had a couple sharp points, but she has teeth everywhere, and I was able to fix all of that. And then we have this amazing product that somebody donated to us called an Equivisor. Let me pick her head up. She's still a little sedated. So we've got some SWAT and some anti-inflammatory medications around her eye, and then this thing is really nice because it's gonna kind of keep that eye protected and keep the other eye protected as well. So she's all done and she's going back out.